If you're somebody who's been looking for options for long-term weight loss success, I am very confident that you would have heard about weight loss medications that have flooded the news in recent times. In this presentation, it is my endeavor to go a little bit deeper on what are the things that you need to know, some key pieces of information that will allow you to make a better decision that is suited for your needs. Allow me to please share my presentation with you, which will go further into these aspects, and it will allow you to gain a better understanding of this subject. The information about weight loss medications is not new. In fact, they are now being dubbed as the new superstar. But before we go further, I want to give you some key highlights of what this presentation will do for you. It will go into four key areas. And the first one is the dosage and the side effects of these medications. Second, expected weight loss. Number three, costs and supply. And the fourth, and perhaps the most important, is whether it is medications or surgery, what is the best option or the right option for you? So let's get started straight away. My name is Dr. Arun Dheer. I'm a gastrointestinal and a weight loss surgeon. I'm also a yoga and a meditation teacher, which allows me to bring a holistic, whole person approach to the whole challenge of weight management. I've often said this, that the real challenge with weight loss is not weight loss. It is weight maintenance. And therein lies the most important element of the weight loss journey for an individual, which is their ability to change their lifestyle or their habits using these tools. My job through this presentation is to give you information that empowers you rather than try to convince you that surgery is better than medications because I am a surgeon. It's not about me, it's about you. So let's get straight into it. I would say this, that the weight loss medications are a new sensation in the market. Names like Ozempic, Mounjaro, and Wegovy are so popular now. In fact, it is beginning to question the role that bariatric surgery has in achieving long-term weight loss. People are beginning to question the efficacy of weight loss surgery. All these medications fall under the category of what we call, as medically speaking, semaglutides or GLP-1 agonists. GLP-1 is a hormone that is produced by your gut after eating. And what it does is it gives you the sensation of fullness and it suppresses your appetite, to put it in the simplest terms. The first thing that you need to be clear is about the dosage and the side effects. Now, these medications have been available in the market prior to their use for weight loss related reasons. Now, they were used in diabetic patients. But the key thing was that the dosage that was required to bring about their beneficial effect in diabetics is far less in comparison to somebody who wants to use these medications for weight loss. Weight loss requires higher doses. These doses have to be slowly escalated over a period of time. As you can see, for Wegovy, going from 1 milligram to 1.7 milligram to then 2.4 milligram, which is meant to be the maintenance dose. And therein lies the power of these medications to stimulate your pancreas in specific and increases the risk of pancreatitis. That is one of the most important side effects. The second question to understand is that how much weight loss can you expect from these medications? Well, the answer to that question lies in the answer to the second question, which is what is your starting BMI? And we will go into this a little bit further, but research is showing that when it comes to the weight loss with these medications, and this is how there is a slight difference in reporting. The medications or the medical journals report that with medications you can lose up to 21% of your total body weight. Whereas with bariatric surgery, We know we have long-term data to prove that you can lose up to 76% of your excess body weight. Now, excess body weight is different to the total body weight. And I think that is really important to understand. Excess body weight is the weight that you need to lose to get your BMI into the healthy zone, which is between 18.5 to 25.6. So with that information in background, there is still some conflict in terms of the quality and the robustness of good long-term data when it comes to medications. These are still fairly new medications, and we do not have that long-term data available. The third, and perhaps the most important way how these medications impact and perhaps not impact when compared to weight loss surgery is the impact of gut-brain axis. This is basically the neurohormonal connection that is there between your gut and your brain, which is well known. And in the mix comes gut bacteria, which is the gut microbiome. Now, this is how these three-way communication happens between the gut bacteria, your gut itself, and the brain. Now, surgery, we know, has got a significant impact on the gut-brain connection. And I don't want to confuse by showing you this complex diagram, but you can see that using the nerves, such as the vagus nerve, there is communication happening between the gut and the brain. There is also gut bacteria which change after weight loss surgery, and there are hormones that change after weight loss surgery. The point that I'm trying to make is the impact that weight loss surgery has on your gut-brain axis is far significant than that can be produced by the medications alone. And as you can see, the changes are far more impactful. And we hear this from time and time again from our patients. We have also done a research study and we have published it that the gut microbiome changes after a gastric bypass surgery are fairly significant. But here is the third point that we were talking about, which is the cost and the availability of these weight loss medications. We know through several reports that the costs of these medications are heavy over the long run because these medications have to be taken for a long period of time to achieve the desired result. The second, and perhaps the more important part, is the availability of these medications, and therein lies the challenge. Whereas when it comes to weight loss surgery, there are also costs associated with weight loss surgery without any doubt. But the good thing is that majority or most of those costs are either covered through insurance because it is eligible, or through Medicare, or through early release of super, whichever way the individual chooses to take. Of course, there is commitment required in both tools or both modes of treatment that we are talking about. Also, let's not forget that these GLP-1 medications have to be taken for a long period of time. It's just like blood pressure. For example, if somebody has got blood pressure, well, they need to be on blood pressure medications for lifelong. Same way, to achieve medical weight loss, you have to be on the medications to be able to lose weight. But the question becomes, can you afford to, because of either costs or availability? Here is a study that was published very recently in a very respected diabetes and obesity and metabolism journal in 2022, which was actually a multi-center study across Europe and centers in United States. It's called the Step 1 trial extension, and I've put the link for you to check it up yourself. But I'll give you the summary of what that study said. They actually followed up patients for a period of 2 years after stopping them on their weight loss medications after the first 12 months. And this is what they found, that almost 2/3 of the participants regained their weight that they had lost. So this is a significant number, and they only followed these patients for 1 year after stopping their medications. So the point that I'm trying to make is you need to know what is a right option for you? Is it medications or is it surgery? Well, the answer to that lies is what is your starting BMI? BMI is body mass index. What we have found is that if your BMI is 40 or over, is something that allows you to make a decision, because let's not forget, as we discussed earlier, that bariatric surgery patients lose on an average of about 50 to 70% of their excess body weight, while patients who are on weight loss medications will lose about 10 to 15% of their excess body weight. But what is critical to understand is there are some weight related comorbidities, and I'll talk about that in a moment. But as you can see in this diagram, joint pains, blood pressure issues, sleep apnea issues, in fact, reflux, regurgitation, and heartburn, these are other issues that lot of overweight patients experience, which can actually be made worse through the side effects of the medications. So keeping that in mind, I provide you with a broad framework over here to help you make a decision. Now, if your BMI is above 40, you have diabetes, you have got knee, hip, joint arthritis, sleep apnea or obstructive sleep apnea, high blood pressure, and also if your age is above 45, you likely are going to benefit more from surgery. I say that likely because there is no written rule, and you will have to consult a medical practitioner who would be able to guide you. Whereas if your BMI is under 40, your age is less than 45, you've got borderline diabetes, but no permanent joint damage, and you're really looking for a kickstart, which means expecting to lose about 10 to 15% of your total body weight, well, medications may be a good option for you. You could even consider other non-invasive options such as the gastric balloon. But that is a broad framework for you to decide. Once again, as I showed you in this previous slide, with GLP-1 agonist, you could expect to lose somewhere about 21% of your total body weight, but some of this weight will be regained when you stop these medications. Whereas with bariatric surgery, you could expect to lose about 50 to 70% of your excess body weight. And there is good, robust data that you would be able to keep that weight off until about 5 years. Of course, there is going to be a small percentage of patients who might fall off that. So the two things that I highlight, which are hard to get back, is number one is time, and number two is quality of life. So it's important to keep things into perspective, which is where I provided you with the framework around what all things are important. So if you're still looking for what is the best option for me, whether it's medications or surgery, and you want to speak to someone, well, you've got two options that I could present to you over here. You could either reach out to our bariatric medical practitioner, Dr. Don Zhang, who is a wonderful bariatric medical practitioner. He's a GP with an interest in weight management. You can call the number that you can see and book an appointment with him. Or if you want a private one-on-one consultation or a chat with our patient advisor, which is complimentary, just to understand the process a bit better, you can scan this QR code and you can make a free complimentary appointment at a time that suits you with our patient advisor, who I must say is not a medical doctor, but would be able to guide you in terms of what could be the next steps. I want to thank you for giving me your time, and I wish you all the very best. Take care.